When the news first came out, I was staying with my sister because of the fact it was over Christmas. And I came down in the morning, she said, oh, by the way, apparently there's been some big earthquake.
Immediately the phone calls started going around the system, everybody calling each other up, should we act, what's going on, do you think we should go and do an assessment, etc., etc.
So we turned on the television and started to kind of hear what was happening.
What we do in these circumstances is we look at the death toll, because the death toll is a fairly good indicator of what the clear-up job is going to be afterwards. In the case of the Asian Tsunami, the death toll rose extremely rapidly, so that by the afternoon, early evening of Boxing Day, it was fairly apparent that there would be quite a considerable amount of work to do, and that Merlin should respond to that.
Within 48 hours, a Merlin team had arrived in Sri Lanka, one of the first overseas charities to organize a coordinated response plan with the Sri Lankan authorities. It was quickly on the road to Batticaloa, the epicenter of the disaster.
When we arrived in Batticaloa, it was really a town in mourning. There were dead bodies around, the smell was awful. There was a soulless look in the eyes of the local population, and it was pretty clear that this was the area that Merlin was going to concentrate on from then on.
Six weeks after Sri Lanka's worst natural disaster, the country's east coast is calm again. But thousands of makeshift graves lining the beach testify to the scale of the tragedy. The tsunami struck here at 9 a.m. on Boxing Day 2004. In a few devastating minutes, more than 30,000 people died, many trapped within their homes as buildings collapsed under the force of the waves. 3,000 died along this stretch of coast alone, at Kalmunai, just south of Batticaloa. Of those who survived, some 200,000 are now forced to live in temporary camps. People like Alia Madina. She escaped the waves, but her struggle didn't end there.
எங்களுக்கு கஷ்டமாக இருந்தது. எங்களுக்கு இருக்க இடம் இல்லாமலுக்கு நாங்கள் பள்ளிவாசலில் தான் போயிருந்தோம். நாங்கள் பக்கத்து வீட்டாக்கள் பள்ளிவாசலில் இருந்து அங்கே ஒழும்புச்சுனே பக்கத்து வீடு ஒன்றில் இருந்தோம். நாங்கள் அப்புறம் அங்கேயும் இருக்க இல்லாமல் இருந்துட்டு அப்புறம் இங்கே வந்து உங்களோட உதவியோடு நாங்கள் இங்கே இருக்கிறோம். நாங்கள்
For Merlin, the priority in these camps has been to maintain hygiene and control the spread of infectious diseases. This once prosperous community has lost everything. Many people are now faced with unfamiliar challenges, like sharing communal facilities such as washrooms and latrines. One crucial part of Merlin's work is to deliver and distribute kits to help people maintain hygiene.
Hygiene is critically important in camps. What you do not want is any epidemics or any outbreak of diarrheal disease, particularly and respiratory disease. This is simple stuff. It's things like a toothbrush, it's things like soap, and we do have health education classes within the camps to make sure that people know how to be clean in a camp environment.
Dr. Sean Keogh, who normally works as an NHS A&E consultant, was a key player in Merlin's plan of action for Sri Lanka.
Are they cooking in one place, or are they each cooking individually?
It was he who devised the charity's response, assessing the country's health needs after the tsunami. Today he's come back to Batticaloa to see how Merlin's work is progressing. His first impressions are positive.
It's the first type of anything that she's been given to do with hygiene and to do with keeping clean. She's been here 7 weeks now, and she didn't have any of these items, and it's when you see this, which is really simple, really basic, really cheap, that you know how effective this programme can be.
One of the reasons that Merlin was able to respond so quickly and effectively to the tsunami crisis was thanks to the support of the general public, in particular readers of the Daily Telegraph. Merlin had already been chosen as one of its 2004 Christmas Appeal beneficiaries, but after Boxing Day, the paper decided to focus its fundraising efforts on the tsunami.
It was the biggest response we've ever had for a Christmas Appeal. I mean, obviously, that relates to the impact of the tsunami. As soon as we started reporting on the work that Merlin was doing, the money just flooded in, and there was one day we got £1 million just in a day, and that sort of happened. So in a period of about 2.5 weeks, we got in £6 million.
Having that money allowed Merlin to expand operations rapidly into the Aceh province of Indonesia, an area that has been described as the ground zero of the tsunami. Here, the Merlin team found whole towns and villages destroyed. Such was the devastation that medical staff and equipment had to be airlifted in. Merlin's priority has been to replace the medical facilities destroyed by the tsunami. Here, the first of these is opening, a temporary clinic built and paid for by Merlin.
Well, the tsunami virtually erased the whole village. Schools were ripped up, roads were ripped up, the health centre was completely destroyed, as all the houses were. Over half the people were killed in this village.
There was a desperate need for primary health care here. Particularly vulnerable were young children and pregnant women who had survived the tsunami, but who've had nowhere to go for medical treatment since.
Well, this clinic is making a big difference to the people of this village. When people are sick, they need to be able to access primary health care and see a medical professional immediately. And Merlin is helping to provide that service here.
Kasmawati lost 2 of her 3 children in the tsunami. She's therefore keen to see her remaining child, Drifki, get proper medical treatment when he needs it.
Sesudah tsunami dulu yo sebelumnya sempit kali tempat obatannya. Sekarang sudah enak, dah banyak para dokter.
The welfare of mothers and their babies is one of Merlin's biggest concerns. Back in Sri Lanka, staff at a government health clinic are distributing Merlin's new mother and baby kits. Many of these women have lost their homes and loved ones in the disaster. The kits contain nappies, baby clothes, towels, and other essentials. For people who've lost everything, they help not only to preserve the infant's health, but also to restore the women's sense of dignity and hope for the future.
Delivery kits because they're going to go later. This is going to go first. Yeah, how many babies? All the baby kits are in the health room.
6 weeks on from the disaster, Merlin has distributed 10,000 family hygiene kits and 3,000 new mother kits in Sri Lanka. It's been a huge operation, including the recruitment of many local staff. Every morning, Merlin's headquarters in Batikloa becomes a hive of activity, taking in new cargo and distributing supplies to those who need it most. But this immediate medical relief is only part of Merlin's work here. Beyond the emergency response, there's a desperate long-term need to rebuild facilities that were destroyed in the tsunami, to leave a legacy of lasting healthcare.
Once all the immediate needs are met, there is then a much more intractable, difficult long-term problem of how you actually reset up infrastructure, how you re-establish systems, how you retrain people who may not be there anymore. And that's the kind of programming that we typically look at. The tsunami response was no exception to that. We looked at that almost immediately. So within about the first week or so, we were holding discussions with the ministries of health in the respective countries about how we would rebuild facilities, what staffing levels they would have, how we would train people.
The challenge is enormous. When a hospital is lost, so too are the vital health facilities it used to provide. This building once housed operating theatres, maternity wards, vaccination clinics.
This is Katankudi Hospital, which was a fairly reasonably large-sized hospital, actually, near Batticaloa. And as you drive up to Katankudi Hospital, it doesn't look too bad from the outside, actually. And then you go under an archway, and you see that inside, pretty much most of the hospital is in pieces. You can see that most of the male and female ward don't really exist anymore, certainly aren't habitable. And we knew as soon as we came here that there was going to be a big reconstruction project needed, either here on this site or elsewhere. We were told by the people who were working here what they most urgently need was somewhere for the women to deliver. And so for this project, Merlin took on the reconstruction and the rehabilitation and equipping of a new maternity wing on a different site.
And that site is here, next door to the local mosque. Following the tsunami, a temporary centre had to be set up here. Sean has come to talk to the hospital director, Dr. Abdul Rifaz, about the new maternity ward that Merlin is planning to build.
Great to see you again. How are you doing?
Fine.
Hello, ma'am.
Yes.
How have things been?
Yes, well.
The foundations have already been laid on a site behind the hospital. In another 6 weeks, just 3 months after the tsunami, a brand new maternity ward will be up and running. The entire project paid for by Merlin.
You look at Katankudi Hospital, it is torn down, it's destroyed. And here we have something kind of growing from the ground, and it makes you, it gives you a really warm feeling inside. You know that plans that you've put in place are now being acted upon, and you know that children will benefit from this. You know that new mothers will benefit from this, and it's a pretty good feeling. Diarrhea.
It's in crises like these where Merlin comes into its own. Merlin is the only specialist UK charity which responds worldwide with vital healthcare and medical relief for vulnerable people caught up in natural disaster, conflict, disease and healthcare collapse. Each year, Merlin helps more than 15 million people in up to 20 countries.
It's now 6 weeks ago since I was last in Sri Lanka. A lot has happened since then. When I left, we had a proposal written on a piece of paper. The emergency healthcare had already started. What we wanted to provide was more longer-lasting healthcare to this population. I come back now, there's a fully fledged programme. There are expats in place, there are many local staff working with Merlin. It really makes you incredibly proud when you see this kind of rapid response, this kind of appeal from a nation that you can do something about. You can actually make a huge difference to healthcare. And that's the kind of thing that makes you very proud working for Merlin.